So for all these hernia procedures, is the post-op recovery about the same, like less than a day inside the hospital?
Not quite. So depending on the kind of surgery, one can give some very, very reliable general predictions of recovery. For inguinal hernia repair, patients are not even staying in the hospital. It's an outpatient procedure. They go home right after, and within, typically a laparoscopic inguinal hernia patient within a day does not require pain medications. Within two or 3 days, they're back to work. And within 7 to 10 days, they are back to full exercise with no limitations. Now you take the ventral and umbilical hernia, because sometimes we place mesh and repair those, but they're so central, and everything we do, and you use core muscles, they do take slightly longer time, up to 1 or 2 weeks of recovery. With hiatal hernia repairs, the last one we just touched on, the outside incisions are very small, they hardly ever hurt, but because we've done more work than just repairing a muscle, and we've actually brought stomach down, we handle organs, the recovery as far as being able to eat a full meal and being back to 100% normal might take longer, but the physical recovery is still fairly short, within a few days.